Hello, guys. Welcome to MSK. This is probably going to be the fourth time I tried to record this because technology hates me. I'm going to share my screen. We're going to try this on Zoom to record it rather than the normal way I do, and hopefully it goes from there. Okay, it says it's recording. It says it can hear me. We're off to a good start. Okay, so as I said, you guys are enjoying that July 4th. Please be socially distanced and please wear your mask. But with that being said, we are going to move along to learning about bones and the musculoskeletal system. So I'm going to share my screen here and we're going to talk about bones. Okay, so I'm going to do this as a slideshow. So throw me a freaking bone here. We got to learn a little bit about bones. So before we talk about bones, we got to talk about the precursors of the bones, and that's cartilage. Cartilage comes in three different types. We have hyaline cartilage, which provides support and flexibility as well as resilience. It's the most abundant, and you're going to find this at the ends of your joints, in the ribs, in the larynx, the tip of your nose. Then we have elastic cartilage, which has a lot more elasticity to it, hence the name. You find this in your outer ear called the pinna and the epiglottis. The epiglottis is that little hangy flap that closes and opens to allow for you to either swallow your food or take a breath of air. And then we have fibrocartilage. Fibrocartilage is very thick and it has a great strength, and we find this in the menisci of the knee and vertebral discs. This is what allows us to have shock absorption in our spine. Okay, so bones and cartilages of the humans. This is where all the cartilage is present that you're responsible for knowing about at this point. So take a good look at this lovely skeleton and he will tell you where your cartilage is at. And other things, it does tell you the different types of cartilage. So we have hyaline cartilage, elastic, and fibrocartilage. It's a great study tool. Okay, so why do we have bones? What's its purpose? It supports the body, it protects the body. So your brain is encased by the cranium, and the cranium protects your brain. The vertebral column protects your spinal cord, and then rib cage and hips protect the vital organs on the inside of your belly. They work for movement, so this is a place for muscles to attach, so you can actually contract and move your arms up and down. Then it's also a place where mineral and growth factor storage takes into account. So that's calcium, phosphorus, our main players, and then it has some growth factors that we'll get into in a bit. Other important things is that it's the site of where we make our blood cells, and we'll learn about that actually next week after our test. But blood cell formation is known as hematopoiesis, and that's found in the center of certain bones, and it comes in red and yellow varieties. Also stores some fat, which is an energy source. And of course, bones are responsible for hormone production, which we'll go into and you will find out about. Okay, we have different ways to classify our bones as far as where they're located in the skeleton. We have axial, which is just your skull, vertebral column, and rib cage. And then we have appendicular skeleton, which is anything that attaches to your axial skeleton. So upper and lower limbs, the hips, and the pectoral girdle. Okay, so we have different types of bones that we should know about. We have long bones, and these are your limbs. They're always longer than they are wide. We have short bones, which are in the wrists and ankles. We have something called the sesamoid bone, which is your patella or your kneecap. Fun fact, babies are not born with kneecaps. They come as they age. Okay, we have flat bones, such as the sternum, scapula, which is your shoulder, ribs, and the skull bones. And then we have something called irregular bones. They just don't fit into any other category because they have a different shape. And that's the vertebrae and hip bone. So here's a nice little figure representation of all the different bones that you can use as a study chart. Now, if we took a bone and we did a cross section, this is what we would see. We'd see on the outside, we have this compact bone that looks smooth and solid, and it's very, literally, it just looks like white glistening cement. Then we also have the spongy bone, and spongy bone is in the center and at the ends of the long bones. And when the spongy bone itself makes little things called trabeculae, and we'll hear that a few times. Okay, so here's a look at the humerus. Haha, not too funny. I know I had to do that. Sorry, guys. All right, so different areas of the long bone. We have the proximal epiphysis, which is the end of the bone, proximal, and then we also have to have a distal, because if we have proximal, we have a distal. And diaphysis is the center or the longest part of the bone. We have the epiphyseal line, which in children will be a growth plate. For adults, it's just a line demarcating where that growth plate was. You can see here on the outside where it would articulate, or articulate means make a joint with another bone, we have cartilage. Cartilage helps prevent friction. So when we move this humerus up and down and bring our arms up and down, we're not grinding bone to bone. There's some kind of give and some kind of rubbery aspect to it. Then in the center here, you can see that there's the medullary cavity, and that's where your bone marrow hangs out. Okay, so this is just another cross section of our spongy bone and compact bone. So compact bone, you notice, looks a lot different than spongy bone. Compact bone kind of looks like tree trunks if you were to take cross sections of them, and spongy bone looks like a sponge, hence the name. Okay, so here's another cross section too. So how do we get nutrients? So nutrients perforate from the outside of the periosteum and come inside to these things called Haversian canals, which we'll go into a second. Those are the centers of those tree trunks, those cross sections of the tree trunks. And in the middle, we have all the marrow. Okay, so this bone marrow. So if anyone's vegetarian, this is not meant to gross you out, but if you ever looked or crunched into a bone, you might notice that on the center, there's this red or yellow softer material. That is the marrow. Its job is to make bone cell precursors as well as blood cells. Okay, when we're looking at the bones, we have little bony landmarks that you need to know. This table 6.2 is in your textbook, and it's really good. I'm more concentrating on the bony landmarks of the skull for the purposes of your class. But examples of markings that we might have is called the head of a bone, which normally you'll find that like the head of the humerus or the head of the femur. So we have something called a facet, which is almost like a shallow cup that allows for another joint to articulate. And we really see facets on the ribs and the vertebrae. We have a condyle, which is a little rounded projection. We'll see that at the ends of a lot of our bones, like the femur and humerus. And then we have things called grooves, which are little furrows. We have fissures, which actually make little openings, and they're much more narrow than a groove. We have foramens. So anytime you see a foramen, you think there's a hole or an opening. Normally that foramen is to let either a nerve or a blood vessel through. We have a notch, which is normally just a place for muscle to attach. Then we have a couple of special ones, which a meatus, which is like a canal-like passageway. We'll find that in the ear. We have a sinus, which is normally a cavity within a bone, and it's filled with air, and it's meant to lighten the weight of a bone. And then we have a fossa, and the fossa is a little depression in the bone that normally serves as a place for a articular or a joint to settle into. Okay. So that's the basics of the bone that I want you to know about. Now let's get into what it looks like under the microscope. So under the microscope, I think bone is like one of the coolest things to look at under the microscope, especially if it's stained correctly. So these are the cells and areas that you need to know for your test. Okay, so we have osteogenic cells, and osteogenic cells are the precursor cells of all bones, and they normally differentiate into osteoblasts. Osteoblasts build bone. They build unmineralized bone. That's the key term there. They build unmineralized bone. B blasts. Okay, so B build. That's the way we remember it. Osteocytes are these mature bone cells. So what ends up happening is that as the bone is being formed, these osteoblasts basically they calcify and they get stuck in the matrix, and they no longer divide, and they normally have that blastability. But what they do is they maintain that matrix and act as a stressor, strange stressor. And then we have osteoclasts, and these break down or destroy the bone matrix. So when we're having, like example, when our calcium levels are not the most optimal, we might have some breakdown of the bone, such as osteoporosis, to make up for that. Okay, so this is a little picture representation of all the different blood cells that you're supposed to know about. And then we have to talk about the actual anatomy, the structure of the compact bone. Compact bone is known as lamellar bone. And it has these three terms you do need to know. One is the osteon or the Haversian system. It has canals and caniculi, and then interstitial or circumferential lamellae. Okay, so in this next picture, we see here that each of these here, all these little tree trunks, is one osteon. Okay, this is our Haversian canal. In the center, the Haversian canal has an area for a nerve, a blood, and a vein and an artery. And then when we see the cross section here, we see that we have the osteocytes that hang out in these little areas called lacunae, and these are the little holes that we see that perforate on the interstitial. And you can hopefully see my pointer here. Then we have the caniculi, which connect each little layer, because there's got to be a way for things to connect, right? Okay, and this is just a cross section of what a flat bone. So if we took a skull and we cut it in half, you'd see that it's be very thin. It's mostly spongy bone, but then you have two thin layers of compact bone to help protect it. I mean, think about it. If we had just spongy bone, that would be really easy to break. So compact bone really helps kind of give more structure and solidity to it. And what makes up bone? Bone is made from something called hydroxyapatites, and these are mainly made of calcium and phosphorus and some collagen. They give our bone hardness and resistance to compression. And over 50% of our bone mass is made by these hydroxyapatites. Okay, you're going to see me switch screens for a moment. So I'm going to stop a screen share, and you're going to see me again while I'm trying to do this. Okay, so then we're going to come into our next lecture, which we're going to talk about all the different areas of the bones. Okay, so we're going to share this screen now. I'm sorry I have to do it this way, but I think that's the only way not to have things mess up on me. And welcome to my office, by the way, you get to see it. Woo. Okay. All right. So with that being said, let's start. So yeah, sometimes anatomy and physiology is not so fun to learn about. So I love this skeletal meme. Let me stop you right there. I lost interest as soon as you open your mouth. Hopefully you guys don't feel that way about me, but I get it. Okay, these are the bones that are responsible for knowing. So take a look at this guy and get to know him real well, okay? I'm not gonna waste time pointing out everything when you guys can take a look. Okay, also in the back, same thing. The only difference here is what you can see is that you can see more of that the hip bones, and you can see the pectoral girdle, which is that scapula being an aspect of the posterior aspect. Okay, so it also does a really great job here is the stuff that's in white gray is your axial skeleton, and the appendicular is all tan brown. Okay, so this is the part I'm going to go in a little more detail so you guys can take a look. So the last two slide sets or two slides you can review at your own leisure. And then skull bones. Skull bones when we start as a baby actually have a lot of give and opening. They're known as our soft spots, and we'll go into that in a few little bit later. And as we age, those soft spots fuse because we don't need our brains to grow like crazy anymore. So those soft spots then become what's known as sutures, which is areas where the bones cement and meet, and they really have no mobility. So we have a coronal suture, which is where you would put your crown on. So if this is the anterior portion, this is the posterior portion. We have the squamous suture right here, and that divides your temporal bone from your parietal bones. We have the lambdoid suture right here, which separates out the occipital bone from the temporal bone from the parietal bone. And then we have facial bones. So these are the skull, and this is the actual facial bones. We'll go into that more in depth. If we took this skeleton head and we did a cross section, you might have noticed that there's a lot of these fosses, these depressions. There's 3. Why would you think there are fosses and there are depressions in the skull? Anyone notice they kind of shaped like the areas of the brain? Yeah, they are, because that's how we keep the brain in there and not moving around. Okay. And this is just to show what it looks like if the brain were present. So we're seeing all those different fosses. Okay, cranial cavities, there's a few that you need to know about. So, major cavities of the skull. So there's cranial cavity. And from this view, we're looking at the anterior aspect. Sorry, I should probably take a sip of water. And then we have the orbital aspects. Sorry, you know what happens when I talk like crazy and don't take a break. Okay, orbital cavities hold your eyes. We have the sinus cavities, which we'll go into a little bit more. Nasal cavities is where the air comes in from your nose, and oral cavity, which you guys will be your bread and butter. Excuse me. And as far as the cranium, there's a few bones. There's 8 cranial bones you have to know. The good thing is there's multiples of some of them. So we have 1 frontal bone, 1 occipital bone, 1 sphenoid bone, and 1 ethmoid bone. And then we have 2 parietal bones, left and right, and 2 temporal bones. So this view of the skeleton you need to know, and the Y has exclamation point, because you might see this on a test and definitely on your lab. Okay, so the bones that you're responsible for knowing are the parietal bone, the frontal bone, sphenoid bone, nasal bone, And don't worry about trying to record or write down everything I'm going to say, because it will be there on that lab for you guys to fill out. Ethmoid bone. So the sphenoid bone looks like a little butterfly that hangs out at the back of the skull. We have the ethmoid bone right here that makes the medial aspect of your orbits. We have the lacrimal bone that makes up part of your orbit. We have the zygomatic bone, which is that cheekbone that makes part of the orbit as well. We have the maxilla, which is the upper jaw. We have the mandible, which is the lower jaw. We have things called nasal concha, which are our warming bones. And they literally, all they do is that when the air comes in, their job is to humidify and warm the air that comes in. And then we have the vomer, which helps make part of that nasal plate and hard palate. Okay. And then the base of the cranium, this is just another representation. You're not responsible for knowing this image, but just highlighting where you see that sphenoid bone. The sphenoid bone is quite large, and the ethmoid bone is quite small. Okay, and this is just to look again at those sutures. And this is the posterior view. If we were to give you a skull and say, where is this? You would tell me it's posterior view and be able to tell me some of the sutures. With that being said, there's a very important landmark on your temporal bone that I want you guys to know about, and that's called the mastoid process. If you guys take your fingers and feel behind your ears, you're going to feel a bump at the inferior aspect of your ears. That's the mastoid process of the temporal bone. A thing here is that when people have ear infections, sometimes those ear infections can transfer over to the mastoid process. The mastoid process, the temporal bone, has a lot of air space. It's meant to help resonate and filter sound. And if that gets infected and inflamed, it can be a serious issue. Okay, and here's another view of all the different bones that we're responsible for knowing. The ones that are in bold are the ones that I really want you to be responsible for. Okay, same thing here, another view. The only bones that's different here is that we have a nasal bone that makes that nasal bridge, or that shape of the bone on the outside that we tend to see in a person's side profile. And we have a palatine bone. The palatine bone makes up the hard palate of your mouth. Okay. And then on this slide, same thing. Some of the important landmarks that we do want to remember is that we have a mental foramen here on each side of our mandible. And that is an area for that trigeminal nerve to come through. And that's one of the nerves that you will be numbing. Other areas of the jaw that you are responsible for knowing is this little area right here called the styloid process. It actually acts as a place for muscle attachment. So it's not just there hanging out and doing nothing. We got the condylar process. Remember, a condyle is something that attaches a joint to another one. And guess what? This is the temporal bone and this is the mandible. This is your temporal mandibular joint. And you're going to be working a lot with this as in your features as dental hygienists. We have the ramus here, which is the majority of the mandible. And then we have the mandibular angle. Okay, and this is just a look. If I took the temporal bone out of the skull, this is what it would look like. You have this mastoid process, and mastoid tends to mean breast. So it kind of looks like a breast, I guess. And then the styloid process looks like a little styloid pen hanging off. Okay, and this is the bottom view. So now this is a better look at what our hard palate will look like. So we have the palatine bone and the maxilla, which make up the hard palate. Back here, we'll get into that when we do more of the ear, nose, and throat section. Is going to be the soft palate. Okay, and as I said before, mastoiditis is a big deal. This is what the sphenoid bone would look like if we took it out, and I just want to stress that it looks like a butterfly, and it's in the center of your skull, and it makes the back of your orbital cavities. Same thing for the ethmoid bone. For some people, seeing these separated out makes it a little bit easier to remember where they are. Okay, facial bones, hint, hint, nudge, nudge. You need to know these. So that includes the mandible, the maxillary bones, there's two of them, because the maxillas come together and they fuse during embryology to make a whole bone. Zygomatic bones, there's one on each side. Nasal bones, there's one on each side. Lacrimal bones, one on each side. Palatine bones, one on each side. Vomer, there's only one. And then inferior nasal concha, there's both on each side. So here's in detail that mandible that I was talking about. And one of the other things that wasn't pointed out is that for your purposes, and you'll definitely learn this in dental anatomy, is that there's this alveolar process right here. And this is where ligaments attach your teeth to your gum line. Here's another view for anyone who needs some more views of the skull. I add this a lot because hint, hint, nudge, nudge, you need to know it. Okay, and here's that mandible. If we were to take this out and just to get a better look of where it was. Remember, every time there's a foramen, it means that there's a nerve or a vessel or both coming through it. And then bones to the nasal cavity, there are 3 concha available. There's inferior, middle, and superior, and they're the warming bones. Okay, and then again at the hard palate, we need to know that the hard palate is made of the palatine bone and the maxilla. Okay, then we have this funky bone that's not part of the skull, but we talk about it in our head and neck. Hyoid bone hangs out in your neck, kind of just below where an Adam's apple might be, or just above where an Adam's apple might be, and acts as a movable base for tongue, because your tongue actually attaches. Your tongue is a muscle, and that tongue attaches to sites down there, as well as other muscles that help you swallow and speak. And there's a bunch of ligaments that help keep that in place. So here is a great example of where that hyoid bone is, and it hangs out right there in the center of your neck. Okay, orbits. I think we already spoke about this, but just to take it on home to Funky Town. I don't know why I said Funky Town. So frontal, sphenoid, zygomatic, maxilla, palatine, lacrimal, and ethmoid all make part of your orbital cavity. These are here to add as attachment sites for your eye muscles and to hold your eyes and your tear glands, your lacrimal glands. Excuse me. And then we have the nasal cavity. So we need to know the different parts that make up the nasal cavity. The roof or the top of the nasal cavity is your ethmoid bone. Lateral walls are those concha. And then just a key note that there's spaces in between these concha. I call them warming bones, but I guess they also increase the turbulence of airflow. So it makes the more whirling inside to get more access and more flow. But in between the concha is called a meatus. The floor of the nasal cavity is the palatine and maxillary bones, which remember is the hard palate. And then you have the nasal septum. So we have the bony posterior part, which is made by the vomer and the ethmoid. And then the anterior part is that squishy part when you press on your nose and you move it around, that's septal cartilage. And then we have sinuses. So anyone who's ever had a sinus infection, I feel ya, they stink. We have 4 different areas of sinuses, and what their job is to do is warm, humidify air, just like turbinate bones, but they also help lighten the skull and enhance the resonance or ability to project our voice or be a little bit louder. So we have a frontal sinus that hangs out just above the eyebrows. We have ethmoid sinuses, which are the sides of the nose. So sometimes when people are saying they're having really bad sinus pressure, they'll pinch the sides of their nose. They're pinching their ethmoid sinus. We also have the same exact area, the sphenoid sinuses that are posterior to that. So that's why a lot of pressure happens there. And then maxillary sinuses. Maxillary sinuses hang out by your nose. And a lot of times if there's pain in the jaw in a patient and it's not a tooth pain, we start thinking, is there a sinus infection? Because the most common sign of a sinus infection is to have upper jaw pain. And this is just a side view of the different sinuses. So you can get a better idea of where they're located. Okay. And then as far as our next slide share, we're going to come back around, and I'm not taking any risks here that this is not recording. So we're just going to kind of move forward if I can figure out how to do that. Okay. So we're going to do a new screen share, or we're going to stop the screen share. Sorry, we're going to stop the screen share. I'm going to move on to the next aspect here. Hello, yes, that's me. I'm tired today. Woohoo. Okay. So let's share this aspect now. So hopefully you're seeing the vertebral. So we're moving down. We're going from the head. Now we're in the neck and the body, and we're talking about the axial skeleton. So this is a perfect point to take a break. I normally play Everybody Backstreet Back because for some reason students love that. Feel free to pause this. Click on the YouTube link if you want, if you can, or find the Backstreet's Back and kind of do that boop, 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 or whatever with me if you want, okay? Normally I would dance with you guys, but clearly, oh, I don't know what happened there. Clearly I can't do that right now. Okay, so with that being said, let's move on. Okay, vertebral column. It's the spine. It's the thing that we think of Mortal Kombat where they say, finish him. It's the thing that they prink up and like, pa-ta. Okay. So we got 26 different vertebrae that you need to know the differences of and remember the regions. Okay, easy mnemonic for this. We eat breakfast at 7, lunch at noon, dinner at 5. And I said, this will make sense, I promise. We're starting at the top of the head. So we think of the top of the morning, 7. We have 7 cervical vertebrae. We have 12, so noon, 12 thoracic vertebra. And then we have 5, if we're going down our meal pattern, at 5 p.m. is a great time for dinner, lumbar. We have 1 sacrum, which is a specialized fusion area of the vertebra. And then we have the coccyx, which is the tailbone. Okay. Curvatures exist in the spine. There's cervical and lumbar curvatures that kind of bend they're concave and they bend posteriorly. And then thoracic and sacral curvatures that convex posteriorly. So this is known as a normal kyphosis here, but we know over kyphosis, but it can be an exaggerated kyphosis, which is abnormal. There's a slight lordosis, which is bending forward of the lumbar and the cervical, and then the kyphotic areas or kyphosis is in this thoracic and sacral area. Okay. In order to keep these keep our vertebra all together and in line, we need ligaments. So ligaments, there's anterior and posterior ones that hang out that go from the neck down to the sacrum, and they help support and prevent the hyperextension or hyperflexion bending forward. We also have something called the ligament flavum, which connects all the adjacent vertebrae. So this is a nice little representation where you see this the ligament flavum, which connects between each vertebra or vertebrae. And then we have the anterior and posterior longitudinal ligaments that go all the way down, all the way up. Okay, who here has heard of a slip disc or hernia disc? It hurts like anything. Had one, it's not fun. So intervertebral discs are these cushion areas between the vertebrae that act as shock absorbers. There's 2 different parts. We have the inside, which is more of a gelatinous area, and it allows it some elasticity and compressibility, which is the nucleus pulposus, because if we weren't able to compress just a little bit, it would be really hard for us to move our spine. Then we have something called the annulus fibrosus, which is the fibrous, more dense area outside. And if for some reason there's too much weight being put on the inside part of the nucleus pulposus, the annulus fibrosus will prevent from that nucleus pulposus coming out. With that being said, here is a cross section what it looks like. So nucleus pulposus this is in the back, or sorry, this is posterior over here. This is anterior over here. Your vertebral discs tend to hang out anterior. And then if we have a herniation like we do right here, what's happening is that this herniation, the pressure that's being involved, or maybe a misalignment of the spine, is pushing this disc outward. And look, there's a spinal nerve right there. It's pushing on it. That's going to hurt and cause symptoms like numbness, tingling, or radiating pain, depending on where it is. And where we feel that pain, because remember from dermatomes from our last lecture, we can kind of figure out which nerve is being affected. Okay. So we talk about herniated discs. They're kind of literally a real big pain. Sometimes they need surgical interventions, but it depends on the severity. Okay, and then we also think about scoliosis, kyphosis, and lordosis. So scoliosis is the most common. We screen kids starting at age 10 for this. And this is when the spine starts laterally rotating in an abnormal way. And most often you're going to see it start in the thoracic region. And if it becomes bad enough, it causes breathing difficulties. Then we have kyphosis, which is hunchback. And we see a lot of that in people who have either vitamin D deficiency, known as rickets, or osteoporosis, which is most common in postmenopausal women who don't have estrogen to help their bone density. And then we have lordosis. Most common reason for us to see lordosis, or that pushing out of the belly, is when someone's pregnant, or if there's a little bit extra adipose tissue around that area. Okay, so these are examples of what scoliosis would look like. Kyphosis, you always think of the elderly woman with the kyphosis, and lordosis. Okay, we have different parts of our vertebra that you should be familiar with. Honestly, I'm not going to go into super depth about them. I just want you to be aware that there's different parts of the vertebrae. The stuff that I want you to concentrate is the differences between the vertebrae, which is why we're going to go through these areas. So we have a body, which is where the most center of the weight is. Most of the vertebra have a spinous process, which if we're feeling down someone's spine, you feel little bumps. That's our spinous process that you're normally feeling. Sometimes we might feel these transverse processes if someone's spine is out of alignment. If you're thinking from a chiropractic standpoint. We have a foramen, and guess what's going to go through here? The spinal cord. And then depending where we are in the body, so this one is most likely a thoracic vertebra because it has facets and articular surfaces to connect with ribs. Okay, so this is just a nice little, if you want to have a, let's talk about it in chart form, this tells you all the differences of cervical versus thoracic versus lumbar. Now remember, cervical, there are 7 vertebrae, but there are 2 at the top that are specialized. Okay, so here we can see how it's different. Cervicals 3 through 7, on their spinous processes, they have something called a bifid process, allows for neck muscles and arm muscles to rotate and lift. The vertebral foramen is much larger, and the body is much smaller. Okay, on the thoracics, we have these very large transverse processes that allow for articulation right here with the ribs. We have the spinous process, which is more pointy and extended, and a more narrow body. But the key thing here is it's going to have those facets that are going to attach to the ribs. Then we have the lumbar spinous, which has this really long spinous process. But the big key here is that vertebral foramen is much more narrow, and the body is really big. And if you think about it, why would the body of a vertebrae be wider when it's going to the bottom? Because there's more weight bearing. Okay, and this is a look, if we're looking at the posterior lateral view, of how they all look together for the cervical vertebrae. And a good way to tell the difference between cervical versus transverse is that you're going to feel down on your neck for a bump. And when you turn, you should feel that bump turn with you. If you go down one lower, you won't feel that little bump turn under your fingers. That's how we tell if we're at C7 or T1. Then for cervical, we have specialized C1 and C2, known as atlas and axis. And this is what you're going to be responsible for knowing the difference for. Atlas, C1, is the one that goes right under the skull. It has these things called occipital condyles that act like little cups that carry the skull. And when you nod yes, you're using that C1 to do that. Okay, there's no body and no spinous process. Then we have C2, which is the axis. And the axis has something called the dens. And this allows the head to pivot around the atlas. So the axis is responsible for saying no, like, no, Dr. Bird, slow down. Let's not do this anymore. Just kidding. I had a long day. Okay. So this is what the C1 looks like, or your atlas. And that's what C2, your axis, looks like. Okay. Again, just to get an idea, that's what all your cervical vertebrae look like in C1 through C7. Okay. Thoracic, there's 12. So just the key thing to remember here is about those facets. Lumbar, big bodies. Sacrum. Notice there's a ton of little holes here. These foramen. This is where your nerves and your blood vessels go, either to your genitals or to your legs. And then we have coccyx right down here, which is your tailbone. And if you've ever fallen and hit your butt really bad on the bottom, you're most likely to bruise your coccyx down there. Okay. Now let's talk about the thoracic cage. So thoracic cage is not Nick Cage here, don't you say, but thoracic cage is made of your sternum and your ribs. And that makes kind of that, when we think of a skeleton, we actually think of this thoracic cage. Its job is to protect those vital organs, helps support the shoulder girdle and the upper limbs, and also acts as a site for muscles for the head, neck, back, chest, and shoulders. Okay, this is what our thoracic cage looks like. So here we have that that sternum, which has this little thing called a xiphoid process, which is cartilage. We have manubrium is the top over here of the sternum, and then we have a body. Fun fact is when you're doing CPR, if you've done it right, this should crack, actually. This little xiphoid process can crack. Then we have things called true ribs, false ribs, and floating ribs. True ribs are ribs 1 through 7. So we count ribs from the very top, and then we count down. True ribs 1 through 7 are attached to the thoracic vertebrae and attached directly to the sternum. Then we have false ribs. The reason why they're called false is not because they're not real or something, or they're fake. And that's 8 through 12. The false ribs are connected. They interconnect with the same cartilaginous piece to connect to the anterior aspect of the body. Oops. And then we have floating ribs. Hold on, what happened there? Okay, hold on, my computer's freezing on me again. Well, we have false ribs, and that is responsible. So false ribs, floating ribs are pairs 11 and 12. They hang out in the back. They're meant for muscle attachment sites, and they don't attach to the sternum. Okay. And then I don't know what's going on here with my computer, but it's not like in my Zoom right now. Please tell me this is recording. I don't want to do this some more times. Oh, come on. All right, well, guys, I'm just going to have to hold up and see what's going on here. My computer just froze again. This is a Mac. It's not supposed to do this. So we'll see. No, come on. Don't do this to me, Zoom. Yes, I'm still here, and yes, I'm trying to figure out why my computer is freezing. Okay.